Did you know that strokes don't happen suddenly, like many people think? In fact, our bodies often send warning signals weeks, even months in advance. But most of them are ignored because they are too vague, too similar to the usual fatigue in daily life. Stroke, also known as cerebrovascular accident, is one of the leading causes of death. But 80% of cases are completely preventable if the abnormal signs are recognized early. In today's video, we will explore 8 symptoms that can appear about 1 month before a stroke. Silent but extremely important signs that all of us need to know. This is not knowledge reserved for the elderly, people with underlying diseases, or those at high risk. This is information for everyone: children, parents, relatives, and yourself. Every little sign can be a reminder that the circulatory system and brain are in trouble. Catching it early can save you or a loved one from lifelong disability. Look at each symptom carefully, compare it with your body, and don't hesitate to see a doctor if you notice anything unusual. Now, let's start with the first sign. One of the most obvious early symptoms is a feeling of weakness or numbness on one side of the body. This sudden numbness or weakness often affects a body part such as an arm, leg, or one side of the face, leading to decreased sensitivity. Although these symptoms usually only last a few minutes to a few hours, they should never be ignored regardless of whether they are a sign of a stroke or another neurological problem. Many people do not pay attention, thinking that it is due to sleeping in the wrong position or working too much. But, in fact, when blood flow to the brain is reduced for a moment, the brain's motor control area cannot function smoothly, creating this feeling of transient weakness. When this phenomenon repeats many times, it is a clear sign of transient ischemic attacks, a prelude to a stroke. 2. Along with transient weakness, another important sign is a change in vision. A lot of patients say they experience blurry vision for a few days. Sometimes their eyes go dark for a moment when they stand up, or they see double. When blood vessels to the eyes and brain get blocked, it messes with your vision for sure. The dangerous thing is that this symptom is not continuous, making people easily subjective. But abnormal changes in vision are never a normal phenomenon, especially if it lasts for many weeks. Vision loss can be caused by a blockage in the artery supplying blood to the eye, which is often a sign of a stroke, the most common type of stroke. So it is important to take such changes seriously and seek immediate medical evaluation. 3. Persistent, unusual, or severe headaches. It is important to note that not all headaches are related to strokes, and not all strokes are preceded by headaches. Witnesses to strokes often report seeing the affected person clutching their head, expressing severe pain, followed by loss of consciousness. This reaction is particularly common in hemorrhagic strokes, in which the headache is often described as the worst of their life. Sometimes, a severe headache can also signal the imminent risk of a brain aneurysm rupture. Not all headaches are cause for concern, but headaches that are persistent, unusually painful, come in severe waves, or don't respond to medication, are often related to blood vessel instability in the brain. When blood vessels narrow, pressure increases, or blood flow changes erratically, the brain reacts with pain, especially if you're not used to headaches and suddenly have persistent headaches that last for days. That's a good reason to get checked out. For another symptom that's easily misunderstood is persistent loss of balance or dizziness. Many people simply think they're sleep deprived, have low blood pressure, or are tired. But the cerebellum, the part responsible for balance, is one of the areas most sensitive to lack of oxygen. When blood flow to the cerebellum decreases, the patient may feel dizzy, have an unsteady gait, or suddenly lose their sense of direction. This condition, if repeated over several weeks, is a big warning sign of prolonged cerebral ischemia. 5. Language is also a system that clearly reflects the condition of the brain. There are people who suddenly stop talking, stutter, or cannot find the right word to express themselves. This phenomenon only lasts a few seconds, but has a particularly important meaning. When a part of the brain responsible for language is deprived of oxygen, the ability to express will be affected immediately, even if only temporarily. Many patients say that they are talking normally but suddenly run out of words, cannot complete sentences, or pronounce strangely. This is not a temporary absent-mindedness, but an early sign that the brain is having problems. A person who is about to have a stroke may suddenly have difficulty speaking. This can manifest as stuttering, difficulty in pronouncing words or speaking in complete sentences. These difficulties are classified as aphasia, which is defined as a decline in the ability to understand, form, and express speech. 6. In addition, unusual fatigue is also a common sign, but this is not the type of fatigue caused by overwork, staying up late, or stress. This is a strange type of fatigue, a feeling of heaviness that lasts for a long time, even when resting. When blood flow to the brain is reduced, the entire nervous system has to work harder to maintain alertness and concentration, causing the body to fall into a state of deep fatigue. The patient may feel sleepy easily, have difficulty concentrating, think more slowly, and feel lifeless for many weeks. This symptom is easily mistaken for a sign of aging or vitamin deficiency, but is actually directly related to the risk of stroke. It is important to remember that fatigue can also have other causes, feeling really tired for no good reason. That could be a warning sign, especially if it's not like you at all. This excessive fatigue may be related to changes in blood flow to the brain. It may be due to narrowing of the arteries due to atherosclerosis, or there may be a blood clot there that is blocking the oxygen supply. The patient experiences symptoms similar to a stroke, but these symptoms disappear completely in less than 24 hours. Usually, this happens when an artery in the brain is temporarily blocked. Within 24 hours, the body dissolves the blood clot in the brain, resulting in thrombosis. This rapid disappearance of symptoms serves as an important warning that a stroke may be imminent. Keep an eye out for this. If you notice any of these transient signs or symptoms, it is imperative to seek immediate medical attention. 7. Persistent high blood pressure. The presence of persistent high blood pressure in the context of stroke risk highlights the dangers of chronic hypertension. If not well controlled, it can significantly increase the risk of stroke. Blood pressure is the force of blood against our artery walls. When it's high, we call it hypertension, and it can be risky for your health. This high blood pressure can damage blood vessels, causing them to narrow, weaken, or even burst over time, all of which contribute significantly to the risk of stroke. If a blood vessel in the brain ruptures due to high blood pressure, bleeding can occur, leading to a hemorrhagic stroke. High blood pressure can block brain arteries, reducing blood flow and causing strokes. Therefore, controlling blood pressure is very important. Adopting a healthier lifestyle and following a prescription medication regimen to control blood pressure are essential steps. These measures are important to reduce the risk of stroke and other cardiovascular diseases. 8. A symptom that few people expect but often appears before a stroke is pain or stiffness in the neck, shoulder, nape area. When the carotid blood vessels, the main path that brings blood to the brain, are narrowed, the body reacts with a feeling of stiffness and heaviness in the neck or shoulder. The pain is not like normal pain, does not depend on how much or how little movement, and often spreads to the head or down to the shoulder. Many people think they have cervical spondylosis, but in fact, this can be a sign that blood flow to the brain is being severely restricted. In general, the 8 signs mentioned above often appear quietly, are unclear, and are easily confused with common conditions in life. But their repetition within 1 month is a strong warning that the brain is under great pressure. Strokes do not always come suddenly. They are the result of silent changes that take place over a long period of time. So, recognizing these small signs early is the best way to prevent tragedy from happening. If you notice yourself or a loved one experiencing 2 or more of the symptoms listed above, especially if they recur repeatedly, it's time to take your body seriously. It's absolutely necessary to check your blood pressure, get an ultrasound scan, measure your blood sugar, blood lipids, and see a neurologist. No signal from your body is superfluous. Every change has a reason, and sometimes it's trying to save you from a serious event. Just recognizing and acting early can reduce your risk of stroke by more than 80%. A number large enough to remind us that listening to our bodies has never been more important. A stroke can come unexpectedly, but it's never really without signs. The body always tells us when it's in danger, it's just whether we listen or not. If you notice any of the symptoms in the video, don't wait. Early checkups can help prevent a major event, protect your health, life and future, and that of your loved ones. Dear friend, health is something that cannot be bought back. If you found this helpful, hit like, subscribe, and turn on notifications for daily health tips. And share the video with your loved ones, especially your parents and grandparents, those who are at high risk but often ignore the initial signs of the body. Knowing just one sign early can save a life. Although the above symptoms can appear in anyone, There are some groups of people who absolutely should not ignore even a small sign. People with high blood pressure, diabetes, high blood fat, people with a history of cardiovascular disease, overweight obese people, smokers, or have had transient cerebral ischemia. In this group, the possibility of a minor symptom leading to a stroke is actually many times higher than in normal people. In addition, the elderly, people with long-term stressful jobs, and people with little exercise are also at high risk. However, the most important thing is, no one is allowed to be subjective. Even young people can still have a stroke, and in fact, in recent years, the rate of young people having a stroke is increasing rapidly. Remember, prevention is always better than cure, and early action is always better than late regret.